Manos and Manos, thanks again for inviting me to give this talk on AC joint dislocations. So these are my disclosures. I will talk about what is important to know on AC joint injuries. I think most of it already Felix, he said about patient's factors and then structures involved. We need to know about the timing, and we need to know about new insights into the workup. That's new studies that came up, and then classifications including horizontal instability. So patient factors is one. We already discussed that during the latter session. One is contact athlete. Is it a contact athlete that we're treating? Is it an overhead athlete that we're treating, a heavy laborer with weights over 25 kilograms? How's the compliance of the patient? And is it a heavy smoker? It's yellow because you can already tell by the fingers if someone is a heavy smoker because they're yellow. So structures involved, we all know about the CC ligaments, but Felix showed us that the AC joint capsule is as well very important, the delta trapezoidal fascia, and concomitant injuries. So this is something that Felix published. So we see that there are the CC ligaments, the conoid and the trapezoid, and then also the AC joint capsule. These are the structures at least involved in an AC joint dislocation. And we need to address the anterior and superior part of the AC joint capsule that was studied by Felix especially, and also other authors. And also looking at different fixation methods, how we can address the AC joint capsule and not only the CC ligaments. So the delta trapezoidal fascia is something that anatomists, they always look at you with big eyes. Why? Because it was never described by them. It can only be seen when you have fresh frozen cadavers, and then you really see it. So that's why here you can see that it's written unfixed, here very small written. So it's a dynamic stabilizer, and we all know that we need to address it, and it helps in anterior and lateral translation. We also know that we have a lot of concomitant injuries, slap lesions, and also rotator cuff tears, chondro defects, up to 33%, and up to 57% of the patients are older than 35. I will show you a study in a moment. And no study is looking at the AC joint disc. A lot of patients don't have it, but we should remove it in chronic cases, but I think Frank will go into this in more detail. So regarding the timing, when is it advisable to have something said that it's an acute injury or a chronic injury? We looked into this by a Delphi assessment, and we found that 3 weeks is considered to be chronic, to be acute, and then the time in between 3 and 6 weeks is subacute, and over 6 weeks is already considered to be a chronic in the AC joint. Right now I will focus on the acute injuries because Frank will talk about the chronic injuries in a minute. So this picture, you already saw it with Felix' talk. We have a good inter-rater reliability in the Rockwood classification. It was originally published as a book article, and it was not an original publication. And then people looked into it, how really reliable is this? And for the vertical component, it's quite reliable. So Rockwood 3, like Felix said, we just have a new publication coming out of Klaus Bach's group. It's one of the most common types of AC joint injuries. That's why Felix had a dedicated talk to this injury. And we have a bimodal peak, so we have the ages of 20 to 24 and 55 to 59. And the most common injury factor is cycling. Okay, so how do we now work up all this complex thing? So first of all, we have to do radiographs, then we do clinical testing, and then we test also for horizontal instability. And here you can see the Alexander view, you can see horizontal override. I don't think this pointer is, there's a nice one. You can see here in the Alexander view that there is a horizontal override of the lateral clavicle over the acromion. There have been many suggestions how to account for horizontal instability. There was 2010 from out of Tauber, Mark Tauber, and then 2018 and 2020, AC/DC. Sounds nice, but very complicated to assess. And now, in recent years, Matthias Zumstein and Markus Scheibel, they looked at the circle methods method in Alexander views. So what are you doing? You create, in the Alexander view, you create a circle around the lateral clavicle, touching the cortical bone, and the same thing on the coracoid. And then you just measure the distance. So this is the classification, the ABC classification that Zumstein in his cadaver workup came up with. So the A is under 7 millimeters, which is considered as Rockwood 3A and less, and 7 to 14 millimeters 3B, and over 40 millimeters 4 and 5. But now there is an updated classification, so the ABC classification, the threshold is a different one, so 18 and 21.4 millimeters. That was just published last year. And now, so we know we can measure a lot, but how do we get the right measurements and the right patient? So in my practice, more and more, like Felix said, are conservative. A contact athlete, especially in hockey players, we know that the NHL players, they need to sign that they won't ever have their AC joint separation operated on, because we know that they always have an impact and they might break off everything. So in hockey players, conservative treatment. Overhead athletes, we don't know yet. In my practice, it's most of the time also conservative if they have a good scapular function. Heavy laborer and malcompliance, of course, and then heavy smoker, of course, because of the complication rate that we are all aware of in orthopedic surgery. So this is also something new that came up after our publication in the ESA, from Knut Beitzel, a new treatment algorithm, and I really like it. So here you have AC joint instability, Rockwood 2 or smaller, so 1 and 2, conservative, as Felix said. Then we have the Rockwood 3s. The Rockwood 3A is with good scapular function, conservative treatment. And then the 3Bs, conservative treatment as well, but if they fail, you assess them after 6 weeks, and if you remember one of my first slides, 6 weeks is already considered chronic. So that's why we should augment it with a biological graft, whatever you take. Then the Rockwood 4 and more, in chronic cases, conservative treatment. If it's already chronic, then if they fail, you can still do the CC stabilization and also address the AC joint, but Frank will go into this, and the acute ones into surgery. So there are over 160 operations. You can put a graft through the clavicle, around the coracoid. Weaver Dunn operation, we can just do single bundle, double bundle. We can use hook plates that we know are not so really good. Okay, so what is now the current evidence? There are new publications that came up now in 2022. Felix already showed this one, so there is no difference in hook plate versus physiotherapy at 2 years. And as Felix said, I don't think we should be comparing to hook plate. And then there is a Cochrane review, and they said that there is no additional benefit in terms of function, return to former activities, quality of life at 1 year compared to conservative treatment. However, they did not do any subgroup analysis. So this is just overall all AC joints. And I think we should be, at least when you publish something in a Cochrane review, you should be more precise regarding the Rockwood, at least Rockwood classification. Then, 2023, last year, a new paper, a systematic review and a network meta-analysis comparing the suture anchors, the tendon grafts, hook plates, tightrope, and endobutton. What did they find? wow, hook plate is the worst. And then the tightrope and the endo button showed less complications. And now what I really think is interesting is the rankings. However, with rankings, you always have to be careful, because for every ranking, the literature is quite small sometimes. However, constant Murray score, so the suture anchors, better than the tightrope, better than endo button. For pain relief, tightrope and endo button are the leaders. And then for the CC distance, the hook plate was better, and the tightrope. And for complications, we have more complications in the hook plate, we know that. In the tendon grafts, of course, when we use tendon grafts, we have more complications. And then the endo button is the third. So they're showing that the suture anchors show better clinical effectiveness and reliable safety, in acute AC joint dislocations. So it's really about the acute ones. So what is the best operation? I think we know that don't use hook plates and K-wires as well. And suture anchor and suture buttons seem to be better functioning than hook plates and K-wires. And you really need to address the AC joint capsule. And the loss of reduction, we always see that. We always reduce the AC joint. It's not really relevant. We always lose a little bit. So, what should you take home from me talking so much? Know the patient. As Felix said, you need to address and see what patient you're dealing with. Then you need to be aware of the timing. This is always critical. Between 3 and 6 weeks, the patients are still in pain, sometimes not. So really, this is something, the timing, you need to watch it. The Rockwood grade, of course, horizontal instability, concomitant injuries, and please don't use hook plates or K-wires. So my thoughts, my personal thoughts about everything I talk now. The circle method on Alexander views, I think it seems to be reasonable, and we can try it. At least I will try it now in my practice, because I think it's easily applicable, not like many other measuring systems. The ABC classification, as you can see, there's still they still don't know what the threshold is, so we can work on this, but we need to consider this maybe in future to use it. Then 3B is still an issue due to timing. If we skip the timing for 6 weeks, we have a problem. Then we need to take a tendon graft. At least we should take a tendon graft. And still our paper from ESA, it gives you a good insight. It's not a guideline, but at least it gives you some ideas how you can think about AC joint injuries. So thank you very much for your attention, and I'm open for questions.